One of the many things that all dental offices have in common is patient records. It doesn't matter whether they're electronic or paper, you have to have those records. Think back to when you were in school and you were trained about how to create your documentation and maintain records. What were some of the significant things that you learned that come to mind? Well, there's three things that I'm thinking of in particular. First, if it's not written down, we learn that it didn't happen. Second, we know that the dental record not only shows the quality of care, the continuity of care, but it serves as your legal defense should the need arise. So obviously, if it's not written down, it didn't happen. And also, we learned that we should never erase our records. We'd always properly amend them. We learned a specific technique for doing so. I'd like you to think about those three qualities with dental records and draw the analogy between your patient records and your compliance policies and procedures. There's a lot more in common to those than you realize. For example, your compliance policies and procedures, if they're not written down, you don't have them. Also, it's just like when you review a patient record. You're looking for the customization. You're not looking for a cookie cutter record. You're making sure that the information in your policies and procedures has been customized or tailored to your practice, right? Then also we want to make sure that we're reviewing them, and we're reviewing them on an annual basis. Bear in mind that along with that is the fact that if you have a fill-in-the-blank manual and you're reviewing it, you wouldn't change information in that policy and procedure to make it current, because there you just lost the continuity of the historical policies and procedures that you had. Same with your patient record. You wouldn't write over it, you would amend or you would update. So just like your patient records, when you sit down and you have a patient encounter, you review those records. Well, your policies and procedures should be reviewed likewise on an annual basis. Anytime you have incorrect or outdated policies and procedures, it's a liability for you and for your practice. So think beyond just having a manual sitting on a shelf. Think about your compliance policies and procedures as living, breathing documents that are on an ongoing basis that you're reviewing and updating them, just like your patient records. So develop that mindset for your practice and have personalized policies and procedures.